healthcare debate, President Obama promised you could keep your healthcare plan, but a new report shows that might not be the case. Analysis of new healthcare rules by the U.S. Chamber of Commerce now suggesting that 51% of all employers will have to drop their current coverage by 2014. But get this, there is one group that gets to keep their very generous plans. Joining us now is a member of the Fox News Medical A team, Dr. Mark Siegel. Doctor, this is a very scary diagnosis.
I've read through this whole document, and I'll tell you something. They point out in here that 83% of Americans want to keep what they have. The president surely promised that, but the bad news is that it's not going to happen. You're not going to be able to keep what you have unless you're in a union, unless you've kind of been contributing to the Democrats. The problem is that they're putting the screws to private insurers in here. They're saying you can't raise copays, you can't raise your deductibles, you can't increase your coinsurance, and if you're an employer, you're not allowed to decrease the amount of benefits you're offering. So if you're an employer, Shannon, and you can't afford what you have, you might drop the plan entirely. We're going to end up with more and more Americans that lose the insurance they have to go to the insurance exchanges, the state exchanges, or on to Medicaid. At worst case scenario, which is also not good, the insurer might say, okay, I'm going to try to comply with this. I'm not going to increase your copay. I'm not going to increase your deductible. Then we end up with a low quality, one size fits all insurance that I'm already struggling with in my office. People come in that aren't sick. Help me out, doc. You do some preventive care, but there's too many patients for this. It's not going to work.
All right, you know, and I know, we all know that many, many times on the campaign trail and since he's become president, the president made very clear, anyone who's trying to tell you that you're going to lose your care, this is government takeover, that's absolutely not the case. I want to flash back to that big joint address he gave to Congress September of last year when he was pushing for health care reform. He said, first, if you are among the hundreds of millions of Americans who have health insurance through your job, nothing in this plan will require you or your employer to change the coverage or the doctor you have. Let me repeat this. Nothing in our plan requires you to change what you have. That may be technically true, but it sounds like from what you're saying of these new rules and regs, I mean, the reality turns out people can't afford to stay where they are now.
It's totally untrue what he said now that we see what this is. This is a draft of regulations. The administration officials have said, don't worry, it's only a draft. I read it. It looks pretty formal to me. And I have some swampland to sell you if you think this isn't going to become a guideline. Let me tell you what happens. Whenever a law is passed, agencies that are going to administer the law get together and put out a guideline. Guess what this is? This is HHS. It's the Department of Labor. This is the IRS involved in this. This is what's going to be. And if your insurance plan doesn't grandfather in, you're not going to be able to keep it. It's going to be illegal. And as you mentioned, for small and large businesses, that's going to involve about 51% of Americans that are currently covered under policies by small and large businesses that are going to be illegal by 2013, according to this draft regulation. This is the government's estimate.
And you mentioned the grandfathering. That has to do with plans that were purchased before March 23rd, 2010. So if your plan changes after that, you are no longer grandfathered in. You're going to lose it, except for if you're part of a collective bargaining agreement, which means bonus to the unions.
No, exactly. And by the way, Shannon, I know what grandfathering means. If I'm in the emergency room and I want to be grandfathered in by an ER before they end up having a board for that, I get to go in just because I've worked there. This is crazy. This isn't grandfathering when if you don't meet a new set of regulations, they take you out of the grandfathering clause. If the president was being realistic about this, he would say, you got insurance, you get to keep it. Even if the insurance changes, you still get to keep it. That would be grandfathering. This is a false statement here. This is not grandfathering. And basically, what I'm really concerned about is that Americans that are very comfortable with the insurance they have now are going to have to go to the exchanges and buy policies they don't like that may be a little cheaper, but it's not going to ultimately save costs to the healthcare system. You know why? Because these are overused type of insurances. The only kind of insurance that actually cuts down on cost are those with high deductibles, because then you have a disincentive for overuse. A country like Belgium, where people have to pay out of pocket, they don't overuse insurance. These insurances get overused and the costs spiral up. As I see more and more patients, I order more and more tests, and patients are less and less satisfied. This is what Obamacare is bringing us.
All right, Dr. Mark Siegel, we're glad you read the 83 pages and could break it down for us.
Thanks a lot,
Thank you so
Jen.
much.